Hey guys, I'm giving you guys a second to see what we're doing. Cleaning off my male top model here today, who I've known for many years, one of my best friends, Adam, who has been plagued by wrinkles, as you know, everyone's plagued by those, but also migraines and muscle tension. And Botox, as you guys all know, my young patients especially know, that it's approved for movement lines, or active movement lines of the glabella, now the forehead, and then potentially even in the crow's feet eventually for approvals. But also originally it was designed for something called dystonia and blepharospasm, where muscle would twitch in the eye. You know, everyone gets those and they hate it. Or when the muscle of the neck would cause a lot of tension and pain. You want to tell your little story?
Yeah, I would love to. You know, years and years of working at a desk and constantly being at the computer and having bad posture. You know, I've always had really bad tension in my neck and my back, and I've tried everything. I had massages and different types of physical therapies, and you know, about 5 years ago when Jason started to do my Botox prevention, started rubbing my shoulders here and there, and he said, you know, what's going on? What's wrong? And I told him about it, and he said, you know, this is what Botox is actually invented for. Let me try it. So he started injecting it into my neck and my back, and it literally changed my life. I had no idea how much pain I was in all the time. And you know, I actually live in New York. I wish I lived here so Jason could be my primary care for this, but I've got to say I've been to so many different doctors in New York.
You cheated on me a little bit.
I did. I cheated a little bit. Well, if we lived in the same city,
I know.
There'd be nobody else. But over 5 years on and off, I've seen other doctors, and nobody is better than Jason. So here I am. I'm ready to do it.
So that's a biased commercial opinion. But one thing I will say is, you know, people have trigger points. How many of you, you know, have these active lifestyles, sitting at a desk, moving around all the time? You just feel tension pulling down on your neck all the time. Some of my patients say it's feeling like a bowling ball is sitting and stuck on their spinal cord and their neck. And so you can actually use the product, and I'm going to show you guys how we do this, to really release some of this muscle tension. So this is our trapezius muscle here, and I can even feel where he has this tightness. This is a trigger point. So in each area that he has a trigger point, we usually place between 5 and 10 units of the Botox. This is a very large muscle group, so you can actually put a significant amount in there without there being really any issues to him. And it honestly, in some people, instantly relieves their tension.
Oh yeah.
And he has it extending all the way to the spinal muscles and even up into the back of the skull, so you can actually feel into the back of the skull. It's not so bad actually this time for him, but we're going to go right up to the base of the skull and give him some units back there where he has those trigger points, and we just go right into the muscle there. And this is so gratifying to people. I mean, you can't even imagine how much tension some people feel. And you can do this all the way down. Now the trap muscle extends like a diamond all the way across the back. And so you can have tension that even comes all the way in here. It's like a stone, it's like rock.
Totally.
So you have to inject into that area, and you gotta give a good amount into those areas that are tight. But it should really relieve the tension relatively quickly. Turn a little to the right side, just
sure.
Yeah, there you go. So we're gonna feel on this other side now. His one side's a little worse than the other. This is a little better, but you can still feel some trigger points, and I can feel a lot of the tension in those areas. So areas that are a little softer will give a little bit less. Areas that are a little bit more will give a little bit more. But in general, you know, this is a lifesaver for some people.
Life-changing.
And it can last months, many months for some people.
Lasts me about 3 months typically.
You know, and in some patients, even these deep rhomboid muscles, it helps a lot in those that have a lot of tension in a deep scapularis area. You know, he's got a lot of tension in this front portion.
You know, until I tried this, I didn't even really know how much pain I was in. Once I did it for the first time, it really changed the way I feel on a daily basis.
Good. No, that's great. So that's the trapezius neck area. But what we're going to do now
So much better.
is go and do some cosmetic. Good, and we're going to let that sit. It's roughly 50 to 100 units per side is what you will do. But you want to be careful not to overdose people who haven't had this before, because it can feel very loose and sensitive. It can feel like, some people will say if you do too much, like those dolls, the bobblehead dolls, like that, you can feel like that if you do too much, which is the truth. So go ahead and lay back. We're going to do some cosmetic now.
Can this help with jaw pain? From
Yeah, and
tension?
actually,
Oh,
so
yes.
interesting about that, what we're going to go is to the next section, which is the temporalis area. Now, this area is really good to treat those that have a lot of tension in the sides or have this sort of pressure, sinus pressure that comes all the way to the back of the head. This is also good for people that have referred pain up the spine. So we're just going to do a small amount. We don't always do this on him, but we're going to go deep into the skull, small little bit, sorry. Just a little bit on each side of the temporalis. And that's just going to give him some relief, I think, to the posterior part of his neck. But it's really good for those who suffer from migraines. Okay, so again, you feel for the temporalis fossa, go down to the fossa. We're just doing about 10 units, nothing huge. There.
I didn't even know that I had migraines until you started doing this.
And then the migraines get better, so at the same time, we're going to give them a little cosmetic improvement with some around the eye. Now in men, I sometimes like to do what I call the matzo ball technique. Just do a big bleb and you press it down. It's like you're back in New York, you know, you're having those matzo balls. And that's a nice area. He doesn't have a lot of wrinkles when he smiles. So this will just give him a subtle improvement in that area with it looking very natural. So I'm going to come on to the other side. Smile again. You can see not too many wrinkles. Relax, especially none at rest. But this is going to be our preventative treatment. And doing the matzo ball technique, we do a nice large bleb right there. And then we just press it down. And that gives him a nice improvement there. Favorite part is, especially for him, if you take a look, he's got a very strong forehead and the muscles actually are doing very well. So you're going to squeeze in for me. You can see the glabellar complex, relax, and we're just going to grab the procedural muscle and inject a good amount there. And that helps with the vertical line that's being created above the nose. Squeeze in again. Good, relax. We're going to grab one of the corrugators and do a nice little squeezing in there. Okay. Just gonna have a little teeny bleb, so I'm just gonna get a little extra in your eye. Good. And then,
It's immediately relieving.
isn't that insane?
Unbelievable.
Some people that have this chronic tension, they don't know they have it. Squeeze in again. Good, relax. So we're just gonna grab the belly. I'm gonna squeeze in right there. Get a nice amount. Squeeze in again on the opposite side. Good, relax. We're just going to grab the belly of the muscle, inject right there. Squeeze again, relax. One more time. Great. So good, now we've done the glabellar complex, and now we're going to do his forehead, raise all the way up. Now the majority of his wrinkles are here, but he's got a lot of frontalis muscle up at the top. And if you don't inject this, what will happen is this will freeze and all of this will start to work. It's called hyperreactivity. So we have to do little blebs up at the top. So raise all the way up. Let me see where your muscle is good. We're going to start up a little bit higher than you would suspect. We're just going to do micro droplet injections, very small little baby ones across, and this will also help any migraines you might have. Good. Raise up again. Good. Doesn't have much movement there, but we're working on just keeping that movement away. Okay, this will help any migraines.
Immediately relieving. Unbelievable.
Coming around. Sorry guys, I need to get on this side. So we're at the way top, which is where most of our migraine treatment will be coming from. Raise up again. Good, relax. Raise up again. Good, relax. Raise up again. Relax. Raise up again. Good. Okay, now raise. We're going to do our cosmetic treatment. Good, relax. Going to do a subtle bit. Now he has a very strong muscle here. just doing little baby blebs all the way across. And the most important thing for those just learning Botox, raise your brow. Is a super strong arch at the edge. If you don't put just a little bit in right there, even though yes, it will keep it down a subtle bit, he's gonna get what's called a flare or a Spock brow. We definitely don't want that. So that is micro droplet cosmetic Botox for not only cosmetic purposes, but also for muscle tension, dystonia, and migraines. So we're able to treat pretty much all of that. Now, some people who get very severe posterior migraines with a lot of that sensitivity, especially in light and in sound, we can then also inject all the way down the ear, down the back here. But since we did the temporalis muscle, since we did the frontalis muscle, and we did the occipitalis plus the trapezius, he's set. And we'll check him in 2 to 4 weeks and see if he needs a little touch-up or not. But his migraines should be under control. He should look better and he should feel better. It's a great treatment. What do you think?
Amazing.
Great. Thanks, guys.
Thank you.